but we're very happy that you've joined us, and we wanted to thank the OU Israel for co-sponsoring with us. And the Eden Center works to make mikvah a better experience for all women and to connect women's health, intimacy, education, emotional and psychological health to mikvah. And so tonight is part of that. And I really want to thank the panelists for taking part and thank everyone who's on for listening. We're very pleased to present this discussion of making space for intimacy. And we're going to be speaking openly about the topics of intimacy, sex, and sexuality with the utmost respect. But as is our general policy, we are going to speak openly about the topic so that nobody's confused. And we want to start by letting you know that we're going to be using direct terms and not lashon nikiyah. So I want everybody to know that milechatchila and hopefully feel comfortable in participating. I want to introduce the panelists for tonight, who are Dr. David Ribner, the founder and chairman of the Sex Therapy Training Program at Bar-Ilan University, and author of the recently published book, I Am for My Beloved, A Guide to Enhanced Intimacy for Married Couples. David, can you just wave and say hello?
And I'm the co-author of that book along with Tali Rosenbaum. And we are very pleased, I'm very pleased to be with you this evening, and we look forward to being able to share some information which we hope will be helpful.
Great, thank you. Lizzie Rubin is the next panelist. Lizzie is a former nurse, and she is a couples and sex therapist in private practice in Jerusalem. She directs the Eden Center's Crisis and Women's Health Awareness Training for mikvah attendants in Israel. Lizzie, just say hello.
Hi, everybody. I'm also very glad to be here and looking forward to an hour of very important information being passed around.
Great. Next, I want to introduce Jody Wax-Press. Jody is also a couples and sex therapist in private practice in Modi'in. She's currently pursuing her PhD in clinical sexology, and she's written many blogs for the Eden Center on intimacy at different stages of the life cycle.
Hi, everybody. Also looking forward to speaking about such an important topic in a candid manner, and we hope to answer some of your questions that we've all been hearing for the past few weeks.
Thank you. And last, but certainly not least, I want to introduce Judith Fogel. Dr. Judith Fogel is a Yoetzet Halacha, a Kala teacher, director of Eden's Kala teacher training course, and she has a PhD in human sexuality.
Hi, everyone. Happy to be here tonight. Looking forward to the conversation.
Thank you. So really thank you for giving of your time, and we're very much looking forward to answering questions and presenting. There have been lots of questions that have been sent to us beforehand. So we're going to start with the questions that we've been sent, which we've sort of organized, and I will direct the questions to the panelists. And then depending on how much time we have left over, we will be happy to open the floor for questions and comments afterward that the participants can ask. As I said, again, after we have covered the topics that have been sent to us beforehand. So I'm gonna start out by saying as a general introduction that we all know how important sex is in the relationship, from the fact that it reduces stress to the fact that it makes people feel closer, and it has a lot of potential benefits. Are there cases now in which sex would not be recommended from a medical point of view? Lizzie, I want to direct that question to you to begin with as a nurse, and also based on what we heard from Professor Mitchell Schwaber the other day, who's the director of infectious disease control in Israel at Misrad Abreut.
Right. So first of all, I want to thank you, Naomi, for organizing this and all the colleagues for joining. It's not an easy thing to do, but we had a very good experience on Thursday night, and hope we have another good experience tonight as well. So I knew you were going to ask me that question because I'm a nurse, but I don't know everything about coronavirus. So I did speak to a few other professionals besides hearing what Dr. Schwaber had to say. I also spoke to an OBGYN, Dr. Amy Kesselman, who might be here and available to answer questions at the end. But to answer your question, is it medically safe to have sex during coronavirus? So there's 4 groups of people that I would like to address. And I'd like to say that I don't think any of us have ever gone through a pandemic before, and neither have the doctors. So it's really not so clear what's going to be, and everybody has a lot of anxiety, which could affect sex. And everybody, you know, nobody knows what's going to happen, and the kids are at home and we're all on top of each other. But for 2 people who have been living in the same house and who have been keeping good standards of hygiene, always washing their hands when they come into the house, they've been keeping social distancing, they have a relationship, they know where the other person has been all the time. According to the professionals, there's no reason why not. People should have sex. It's also preferred that people do that, because we all know that, and we're going to talk about the benefits afterwards, but certainly for 2 healthy people, there's no reason not to. We know that the coronavirus lives in the nasopharynx, and the nose and the mouth, and then the gastrointestinal tract. So there could be a problem with saliva. So that's why we're not kissing our grandchildren or kissing our friends like we are social distancing, but that's one of the reasons that we're not doing that. But for couples that would be okay, the only thing that's not okay is any sort of anal touch, because the end of the gastrointestinal tract is there, and that's not recommended. Okay, next group of people would be people who are in isolation. From what I hear, absolutely not. Anybody who is in isolation should not be having any sexual relations. They should not be having any contact with anybody else. There are situations where 2 people could be both in isolation together. The question is if one is there because their student had it, and the other one just got off an airplane. They might be in different days of bidud. It is not recommended for anybody who is in bidud to have sexual relations. You can still ask your doctor. This is not a medical answer for everybody, but please ask your doctor if you have any questions about this. The 3rd group is anybody who has any autoimmune disease or medically compromised, high blood pressure, lung dysfunction, such as serious asthma. Ask your doctor if it's okay to have sex these days, because we don't want to compromise anybody's immune system. And the 4th group is anybody who works in a high risk area, such as a hospital, doctors, MADA, people who go out, nurses who go out into the public. I think if they should ask their family doctor if it's okay, because they may be a carrier. They may be at risk to be getting corona. Nobody knows when they have it. And I would just say that these are some basic guidelines. And of course, ask your doctor. We know that sex is something important for people to reduces anxiety, makes people healthy. It helps us bond. It helps us feel more relaxed. It releases tension. All those things, all those emotional parts are so important. We need them so badly now. So we're hoping that people who are okay to be together, go for it.
I think that you stressed the importance of asking your doctor, but I think sometimes people are a little bit hesitant to bring this topic up with their doctor because it can be embarrassing.
I guess as a sex therapist, I'm so used to talking about these things, but you're right. There are other ways to get answers. You can write a letter, a question to the Eden Center. I'm sure we'll be happy to answer it. You can look up online people to ask, but I still think the safest thing is to ask your doctor, who knows your body better, medically than anybody. So yeah. it might be.
Jody, did you want to add something?
Yeah, I wanted to add a little bit about bringing up sex with our doctors. I taught at the Hadassah Medical School human sexuality course for about, I don't remember, 7 or 8 years. And one of the things that we stressed was the importance of being able to speak to your patients about sexuality. And it is a topic that creates some sort of attention, some sort of discomfort. But my recommendation is to recognize that when we speak about our bodies and our physiology with our doctors, we so often talk about intimate subjects, and there's no difference when it comes to talking about sexuality. Sometimes it takes us, we need to take a deep breath and just say, I have a question that is a little bit difficult for me to broach with you, but it's very important. And that sort of opens the door for both you and your doctor to have permission to feel a little bit of that discomfort, and to recognize that it's really important to talk about. Doctors are trained to talk about sexuality with their patients, and they need to recognize, I hope there are doctors on here also that will open up the subject with their patients as well.
Great.
So can I just say one small thing?
Oh, hi, Amy.
Hi, how are you? So I'm Dr. Amy Kesselman. I'm a gynecologist. Baruch Hashem, I've had an inundated number of patients on my WhatsApp. And patients, Baruch Hashem, are interested in the topic right now and are very much asking questions both about how to practice safe sex during the time of coronavirus, as well as asking questions about how to take birth control pills so that they can skip their placebo week and delay their period, because having intimacy is extremely important to them right now. But at least from my end, I could say as a gynecologist that patients are reaching out and asking these questions.
Great, thank you. Judith, are you still on the line? Because I wanted to direct the next question to you. If not, I think she dropped, so we'll come back to her. But David, I wanted to ask you, I hope it's okay with everybody that I'm using first names and not calling you professor, doctor, etc. How do we find time for intimacy when our kids are around all the time, when tensions are high, when people are stressed? And how do we make space for it in our relationships? And what about issues of privacy in the house that might be busy? How do we deal with these kind of issues? One second, now we hear you.
You can hear me now?
Yeah.
Okay, one clarification before we proceed, and that is, we're talking about sex or physical relationships in a marriage, but that really covers a very wide variety of human behaviors and different kinds of touch, from a gentle caress on someone's cheek to actual full social intercourse. And I think that we really, in the time we have available, cannot address every one of those behaviors in terms of the extent that it may be helpful or not helpful, healthy or not healthy. But I think if people who are part of this discussion this evening have specific questions with regard to a specific kind of physical touch, a specific kind of sexual interaction with their partners, I would encourage them to ask about those, okay? And I think that might be a clarification that would be helpful to people. We're not only talking about sexual intercourse here. We're talking about, again, a wide variety of behaviors. Having said that, I think the question that you ask is very relevant in terms of, well, what do we mean when we say that it's difficult to be intimate with your partner when you're in the throes of a home full of children and you don't necessarily have the time or the space to have that kind of intimacy that you may have had before? Certainly, it may be even more of an issue when the exhaustion of all the anxiety and the different kinds of life changes people have to go through don't make evenings necessarily the best time for people to be together. I don't think there's anything wrong with a couple letting children know that parents need a few minutes to be by themselves, alone in their room, and that they really respect that children should not bother them during that time. And in that room, again, there are a wide variety of issues of possibilities that can arise. I think any couple that has children and doesn't necessarily have a parental wing to their apartment, to their house, they all learn how to be quiet lovers. And I think that that is something that is part of this experience as well. In addition, some discussion in advance of exactly how much time they want to spend there and what they want to do will reduce any of the question marks that may arise, and people can then sort of allow themselves to, within that framework, enjoy that kind of experience if they want to. This may take a certain amount of experimentation. It may not work the same way every time. But again, I want to emphasize the fact that it's really okay for the kids to be told, mommy and daddy need some time by themselves now. We're going to close the door. You guys take care of yourselves for the next 20 minutes, 30 minutes, or whatever. I think that's perfectly okay.
Great. Okay, that really answers one of the women who wrote in asked specifically about making space during the day and also carving out time when their children are around. So I think, thank you for answering that question. How do you think that the issue of stress impacts on our intimacy? And Jody?
Yeah. So the issues of stress can impact on intimacy, on our sexual function, and on our sexual desires. So when we're looking at different areas of sexuality, we're looking at arousal, we're looking at desire, we're looking at pleasure, satisfaction, and also we're looking at compatibility. So we have a few different layers here. Number one, a lot of people look to sex to reduce their pressure, to reduce stress and reduce tension. It's been spoken a little bit more about for men, but that's not definitive. Women also will look to experience sexual release and intimacy with their spouse in order to release sexual tension. They'll look towards sexual experiences to form intimate bonds also. And then there are some people that will feel that they're too stressed to even think about sexuality and to think, well, sexuality, sexual relationships, that they'll feel like this is just another chore that I have to do today. And I think this is an opportunity for couples to open up a difficult conversation, one that is so important to have even in our normal lives. And a lot of times, again, we just have to get that opening question out there, or opening statement out there to our spouse saying, I'd like to talk to you about our sexual relationships and our private time together and what our expectations can be. It's a hard conversation, but I can assure you it's very, very worthwhile. We want to also address the area of performance anxiety that very often when we feel anxious about our performance, whether it's for men, erectile issues or lubrication, or even getting our head in the game. We feel like, oh, we only have 20 minutes now because we sort of, set the timer for our kids to do something. That can create a sense of stress. And that's something that we're going to have to take into consideration and use some mindfulness techniques, try to be intentional with our time and really focus on what our goals are.
Great. Lizzie or David, do you have anything to add in terms of how do we deal if spouses have differences of opinions on these things, or any other issues that you think might come up? Lizzie, did you want to say something?
Yeah, I wanted to say that again, it's just like Jody was saying, how communication is so important. Like if one couple would like to be together and the other one doesn't, it would be if they could communicate to each other, listen, I love you and I care for you, but right now I'm too stressed, but let's think of other ways that we can be together and maybe we can find another time, not right now. Communication in a soft, warm way, and is very, very helpful to know. Like a soft startup is always a great way to have this conversation. And the other thing is just not to forget about touch. Just touch your kids and touch your husband, touch your wife. Just regular touch, hugging, caring, is so important to make the other person feel like you haven't forgot about me and that we're still part of each other's lives, and to just make sure that touch happens, because we're all feeling very lonely. We're feeling under stress and anxious, and
I think it's such a good point, because it's sometimes really hard when you're stressed to even say, can I please have a hug right now? And that's an important thing also. You can actually ask. That's what I hear you saying.
Right. Have a hug and take a deep breath while you're hugging, and hopefully that'll feel good.
David, did you want to add something?
Yeah, I think one of the things that we are all saying is that emotional intimacy is just as important as physical intimacy, and that if that exists within the couple's relationship, it's much easier then to flow into some kind of physical intimacy that's going to be satisfying, because one is necessarily built on the other. And emotional intimacy can be something that's worked on, can be invested in just about any time, in any kind of circumstance. And that needs to be emphasized when couples are thinking about exactly what Lizzie's talking about, the loneliness and the stress, or the kinds of responses that Jody is talking about. It's the emotional intimacy that we think needs to be the fundamental beginning of any kind of process that may lead to physical intimacy.
Great. Judith, I want to come back to you now, because we're talking about physical intimacy, and we aren't going to discuss on this webinar the halacha question of whether there can be hakalot if, during this time that's so stressful for women who feel that the harchakot are difficult for them, because it's really beyond the jurisdiction of this conversation. And if couples are finding this challenging, they should first discuss it with themselves, and then there are plenty of halachic authorities and halachic voices that they can talk to about that question, and specifically with a person who knows them to discuss this. But if we can't go to the mikveh, or we haven't gone yet, or this time is extremely stressful, how can we create intimacy if we aren't allowed to have sex? What do you recommend? Judith, hold on, because we have to unmute you. There we go.
Okay, just want to make sure you can hear me. You can hear me?
Yeah.
Okay, so I think that it's definitely a stressful time, but I think that also it's like any other time that a couple experiences nida, right? During the times of nida, when a couple is not able to be physically intimate, there's still emotional intimacy, which is so super important. And that means taking out the time to just spend the time together, right? Going into your bedroom and closing the door and just having private parent time together. I think that also means, maybe you'll play a game together, whether it be, a deck of cards or a puzzle or who knows what, but just spending time together is something that's super important. And it could also be deeper, just having conversations, making sure that there's alone time for the husband and the wife, between the two parents. And I think that that's throughout the time when a couple is in nida, that's important. And even more so now, whether they're being physically intimate, and especially if they're not being physically intimate, there needs to be the time that they have, just the two of them as adults together. And I think that we also have to realize that also this has an endpoint. Just like nida, at the end of the day, the couple, the wife is going to go to mikveh. This too, the coronavirus hopefully has an end to it. The bidud will have an end to it. People will be able to go to the mikveh, and to just realize that at the end of the day, the couple will be able to be back together to be physically intimate. And the amount of time that the couple puts in when they're not able to be physically intimate will also have an effect on the time when they are physically intimate.
Fair enough. And the truth is that for anybody who missed it and wants to hear the recording of what was said the other night about how to make mikveh going right now the safest possible, while Misrad HaBriut has said that it is still safe, I'll put the link in the chat so that you can all hear the recording. But thank you for that, thinking about how we can be intimate in emotional ways, even all the time when we're in nida, is such an important thing. I want to now turn and ask about, some of the things that we've talked about, and now we've sort of gone into the area of couples who are observing nida, but I think that the stress that's there is probably there for couples across the spectrum, whether they have children or don't have children, whether they are past the age of mikveh going, not past that. Can somebody address that? Is there, anything that couples who are married for longer should be thinking of? David, would you be willing to address that?
So let me start with one population, which is, as you mentioned, those who are past mikveh times in their lives, where there isn't any really constraint on the amount, theoretically at least, the amount of time they can be spending with each other physically. But I think that needs to be negotiated very carefully, because the fact that people now are in a stressful situation does not necessarily mean that all of a sudden they should either be all over each other all the time, or not be in physical proximity with each other at all. We're really talking here about, as much as possible, maintaining some kind of normalcy in our lives. I think that's what people have been referring to, and we all have anchors that keep us in those kinds of normal situations. And it may be work, which we really don't have right now, but certainly a community which we're not nearly as connected with it as we once were. But family and spousal relationships, those are anchors for us. And when people begin to get to that place in their lives where they may be even more isolated because they cannot be with their children or their children's children, that sense of isolation may in fact be helped along by the fact that there are now no constraints on the kind of physical contact they can have or the amount they can have. But that needs to be negotiated. In other words, we've all talked about the importance of communication here. That needs to be negotiated as well. Is this something that's going to be helpful for us if we somehow shift this anchor in some way, at least temporarily? And it doesn't necessarily imply that if we do make that shift, that's going to be permanent once this crisis situation is over. So I think for that population, while they don't have to worry about the constraints of Nida and Mikvah, they do have other constraints that are a concern to them. And again, they need to be able to wend their way through this in a manner that works for them, even if it means discussions almost on a day-to-day basis.
Well, okay, great. Lizzie, do you have anything that you wanted to add?
Say the question again, because I thought I had something. Go ahead.
I was asking about people who are not keeping Nida right now, but the truth is, let me go on to ask you all for any practical suggestions that you have for increasing intimacy, for creating the atmosphere that may help people to feel more intimate. What are practical things that we can do? Jody, do you want to start with that?
Yeah, so I was actually reading some great articles, and there's one that talks about 8 different types of intimacy. And a lot of what we're talking about here is the fact that physical intimacy is not necessarily sexual intimacy. There's affectionate intimacy, which can be holding hands or rubbing each other's backs or giving massages. People that are in isolation, in quarantine, or that live by themselves, it's very important for them to give themselves physical touch, and affectionate touch, and to give, to moisturize and to sort of like give themselves a little bit of a shoulder rub or something, just to satisfy that very, very human need to be touched. There's aesthetic intimacy, which is really interesting. It's sharing something aesthetic with your partner or with your family. It could be music, it could be art, it could be watching family videos together. There's intellectual intimacy, which is learning together, preparing for the Seder together. Even I know my husband had a spoiler alert to my mom here. We're asking the kids to write Divrei Torah for their grandparents who won't have their children and grandchildren with them at the Seder, unfortunately. And that's intellectual intimacy. There's social intimacy, which is created by doing what we're doing right now, reaching out to people in ways that we can. Clearly, there's spiritual intimacy, which can be, I think a lot of us have been experiencing that when we have family non-minyanim, when we have family davening time together. And of course, there's sexual intimacy. So we're really not limited to only speaking about sexual intercourse when we're talking about intimacy. There's something that we call outer course, which is physical sexual intimacy that may feel more comfortable for some people at this time, which will reduce performance anxiety, which will reduce any kind of pressure to get to a certain point sexually where you can just sort of snuggle and just enjoy one another together. So they're all different forms of intimacy.
Can you define outer course better for those of us who are not familiar with that term?
Outer course is any kind of sexual intimacy that does not include penetration. So it could be reaching orgasm in ways that don't include penetration.
Okay, David, did you want to add something?
Well, I think that one classical perspective on this is that any place you have skin on your body, you have nerve endings. Wherever you have nerve endings, you can enjoy touch. So maybe this is a time for people to begin to not focus so much on their genital areas or erogenous zones, but being able to say that I'm prepared to give some touch or receive some touch from head to toe. And I think, again, as Jody has pointed out, that could ease some kind of the performance issues here. And on the other hand, open up a whole new window of opportunity for people that may not be stressful at all. On the contrary, it may relieve a certain amount of stress because they know this is now a viable option for enhancing their physical contact with each other.
Judith, did you want to add anything about the practical?
Sure. I think it's also something that we think about is the environment in which we're in. And today, when all of us are so connected to our cell phones and constantly getting updates about the news and the WhatsApp groups, it's super important when we're trying to create this intimate environment to leave those devices outside, to like try to create an environment where we're detached just for a little bit, an hour, 2 hours, detached from what's going on. It's something that happens over Shabbat, but it can even happen every single night for a couple of hours to just detach yourself from that in order to be focused in the moment. And I think that that's important.
Great. Lizzie, I think you had some other types of things like playing games. What other kinds of things do you think can create that intimacy?
Well, I was just thinking, I think every couple has to ask each other, what are the things that we like to do together outside of being in bed together? I mean, every couple has, some like to watch movies together, some like to play cards together. I was thinking that, you know, there's a lot of people out there that need some connection, whether it's a neighbor or whether it's friends. I think if couples maybe sat down together and said, like, who should we call or who should we get on Skype or Zoom with, make that also would connect the couple to be doing something, you know, some sort of a chesed, and to call people that would need them. I think it would be a nice thing for people to create some emotional intimacy for themselves when they reach out as a couple to someone else who might need them, or just whether just to talk to them or whether just to see if they need some help. There's a lot of people out there today that really are alone and could use a phone call and if we could do it as a couple, I think it's very connecting.
Great.
You asked about games. I just thought of exercising together, cooking together. There's a lot of games. There's a lot of erotic games. You can find them online. Learning together. Every couple should find what they like to do together and then do it and enjoy it. And I think that creates emotional intimacy.
What you're actually saying is that there are all kinds of ways to engage in foreplay, which may or may not lead further to wherever the couple want, meaning that emotional intimacy, in which you've just described a lot of ways to do, is actually setting the stage, whether it's directly for right now, moving on to the next stage, or just creating an atmosphere within your relationship where you feel emotionally close.
Right, okay. And not to forget the touch. Okay.
I want to add that everyone can download, if they want, an app on their phone called the Gottman, Gottman card decks, which is a John and Julie Gottman, who are the gurus in relationships, couples therapy. They have an app that's completely free. That you choose a card and it brings up a topic, and then you discuss that topic, and you can choose, all different areas that you'd like to discuss. It could be more fun, more play, more games, or something that's a little bit more serious, and it's completely free, and you just download it on your phone and you have it right there.
Great. That's great. Jody, I actually wanted to ask you, because I think John Gottman also speaks about other aspects of coupling, which are sort of the basis for creating healthy marriage and intimacy. And I think that would be helpful now during lock time to think about what are tools for strengthening relationships in general.
Yeah, John and Julie Gottman are really fantastic. They talk about the masters of relationships versus the disasters in relationships. And they have a few different guidelines for that. But the main gist is those that master their relationships are people that really turn towards each other, that are interested in one another's lives and learning more about one another. They're more gentle with each other. They're kind and compassionate. They're affectionate. They have a sense of humor, and they're very considerate. They'll also prioritize their time together, which is really important, especially now when we have so many things on our minds. I know I wake up in the morning and I'm like, I feel like I have a whole day ahead of me. And by the evening, I'm falling off my feet because there have been so many things I've been trying to juggle. But prioritizing our relationship is key, because that's what is, that's our safety net in our home. That's what we depend upon. And once we establish this kind of a healthy relationship where we're turning towards each other instead of away from each other, when these difficult times come up and we snap at each other, we have something to fall back upon. We're able to come back and say, I'm really sorry that happened. You know, let's rewind and redo. You know, the kids say, "Poos," you know, stop, hold on, let's redo that. And that's a lot more available to us when we work on our relationship and we build trust and commitment within our relationship.
Nice, thank you.
Can I just add something? That John Gottman has this other, he also says that five positive remarks to one negative remark.
Uh-huh.
He says that, you know, we should be probably very mindful that since we're in the house all day long with the kids and with their spouses, that we should keep remembering, always say nice things, look positive and say, oh, that's one, you know, we forget how much we need that when we're so stressed out. But if you can giving a lot of
Hold on a minute, Lizzie.
oh, okay.
Say again.
If we can focus on giving a lot of positive remarks one to the other, it's sort of like if a criticism comes out, then okay, we can handle it. But it's very important in these stressful times to actually be very mindful to always be saying good things to each other. It creates emotional intimacy for everybody, for the kids, for the parents, for the spouses, and for ourselves.
Very nice. Great. And now I just kind of want to open it up to questions from the audience, or if anybody has anything that they wanted to add. David, Jody, Judith. Judith, I think we should just concentrate for one more minute in terms of the NIDA framework and how we create intimacy during times that we're not able to. And especially, I think it's important at this time right now to talk about how a couple negotiate if one feels like one of the couple feel that the woman should not go to the mikvah for health reasons or otherwise, and if the other one does want, how do we negotiate that a little bit, and how can that affect our intimacy as well?
Well, I think that's a very difficult question. It is difficult when one person wants, like really feels a difficulty going to the mikvah because let's say she's concerned for her safety, even though we had our webinar that said how to navigate that. If someone's anxiety level is high, sometimes they might choose not to go to the mikvah. And therefore, it's a really important conversation to have between the husband and the wife, like with any other type of negotiation where one person wants to have sex and the other person does not. It's constantly this back and forth where people have to respect, you know, where one person has to respect the other person's wishes, not wishes, but like try to understand where they're coming from, and the other person also listening back for that. So I think that it's part of negotiating any type of environment, but even more so, we have to understand that these are challenging times and our anxiety levels might be higher.
Great.
I'd like to add that when we put, the more pressure we put on ourselves, the more difficult it will be. And if we see that our spouse is less interested than us, then what we want to do is tell them, I really feel the need to be close to you. What can we do that you will feel comfortable in doing? And here I'm not necessarily talking about going to the mikveh or not going to the mikveh, nida, not anything halachic. I'm talking about in general, when there's a difference of need and when there's some sort of a disagreement, pressuring someone is never going to work, right? You can never convince someone else to do something your way. That's not okay. They have to be able to come to that on their own. And what can you do to help them come to a place? What can you do to help yourselves come to a place that both of you will be comfortable? It's very important to recognize that if the more you pressure someone, the more they're going to pull back.
Great. Okay. So there are some questions that are being sent on the chat now. And some of them are, Jody, can you put in the John Gottman app? And I am sending to everybody the link to watch the recording from the other night. But are there other questions? And Dr. Kesselman, I noticed that you had wanted to make a comment before. Do you want to share what you were thinking or the question?
I just wanted to add to what Jody and Lizzie and a few other people had mentioned about the importance of communication and the importance of not pressuring. I wanted to emphasize that for women, especially during the time of increased anxiety and stress, that it does impact the vaginal tissue, and that we should be very careful to prevent women from feeling the additional pain. Women should understand their bodies and know that during the time of increased anxiety and stress that their vaginal tissue may have less secretions. Lubricants are extremely important during this time, and that it's okay to say no if a woman is feeling pain, and to really communicate with her partner things that are feeling good and things that aren't feeling good, and not to pressure herself to kind of do something that is really not feeling good on her body, that there will be additional repercussions later if she's pushing herself, and then it will cause her pain and then not feeling good. We don't know how long this is going to take to evolve and to get over this course of what's going on right now. Women should really just communicate well with their partners and do what feels good, do what doesn't cause them pain, and to try to adjust the intimacy to what actually feels good for both couples.
I want to also just add, since somebody asked that, and then Judith, you'll go ahead, Judith, and then I'll.
Well, I wanted to speak about also from the standpoint of Yoatzat Halacha, is that even though we do deal with the times of Nida, it is also really important during these times to ask questions about whether a woman actually goes into Nida. I've gotten a bunch of questions this week about women who have been staining, seeing a little bit of blood, but it's not a flow, and they wanted to know whether they should start to go into Nida. And I think that those questions were totally spot on, that people should be asking those questions, because we're going to try to avoid being in Nida unnecessarily, especially during these times of stress. So I think that that's number one. Number two, if people had an option about whether they should stop their pill and get their period, or whether they should continue and take another pill, besides the fact that that's a doctor question, we have a doctor here as part of the webinar, but from a halachic standpoint, there's nothing wrong with, well, if it's medically okay, to taking two packs in a row, or trying to extend the time that the couple is mutar, is permitted to be with each other.
And I wanted to add in, because people had asked, if somebody was sick and they're now not sick, or they were in bidud and they came out of bidud, is it then safe, or do they have to wait extra time before they are able to engage in relations? So as far as we heard the other night, as soon as you're out of bidud and as soon as you're healthy, then you can go ahead. Lizzie, did you have any other information?
I
want
would
to confirm that?
Dr. Kesselman to answer that question.
It's extremely important if the person was in bidud, that they are feeling perfectly well. Again, we know that corona can have different symptoms for different people. If they're at all symptomatic, it's extremely important for them to have a negative corona test before being intimate, especially if their partner is at all immunocompromised or has any underlying medical conditions. So everybody should really be careful about, if they were in bidud, there was a reason for them to be in bidud. And unless they're 100% feeling perfect, that even the slightest bit of, whether it's a headache, whether it's a slight cough, whether it's a slight fever, please make sure that you test negative before going to a partner, especially that is immunocompromised or underlying medical conditions.
Great. I wanted to shift for a minute and ask about the complexity of this question for couples who are trying to get pregnant, and how to deal with now the pressure, and also the issues, should we, shouldn't we, how do we do this in a time which is so stressful as it is? Does anybody, Dr. Ribner, do you have anything to suggest?
Well, look, I think, again, medical questions needs to be dealt with by physicians, but I think in general, the emotional stress and the emotional price that people pay who go through fertility treatments is enormous. To have that added on to the stress that people are going through just on a day-to-day basis today does not seem to be at all beneficial. However, again, we all know the pressure that couples feel when they want to have a child, and that has not become available to them at this point. So I think it really needs to be weighed very carefully. But assuming that we're not talking about an endless amount of time that all of us are going to be stuck in our homes with our families, waiting a couple months for this, I think, was probably going to be the easiest way for them to deal with the existing day-to-day stresses. That's one thing. I just want to, Naomi, go back to one moment to the issue about couples who have variant levels of desire, and that often that comes to be it actually is by statistics, the most common problem that comes to the offices of sex therapists. And I think that that needs to be seen in the context not only of the suggestions that Jody was making, but in the context also of, well, what does it mean in terms of their overall marital relationship? How do they want to see each other as a wife and a husband? How do they want to look back on these years and say, well, did we really invest in our relationship in a way that we wanted to? And do we have to really be able to say to ourselves now, what can we do to make sure that this is going to work for us? Because a physical relationship is part of a marital contract. And whether or not it is something that happens every day or happens once a month is only relevant to the extent that it's satisfying for both people. But I think they do have to see this particular aspect of their lives in the context of their overall marital relationship. And one other thing I just want to mention, one of our colleagues is Peggy Kleinplatz. She is a religious woman from Canada who is one of the preeminent sex therapists and sex researchers in our time. And she has done a lot of work on what she calls great sex. And she just published a book, and you can find it on Amazon. And it has nothing to do with sexual positions. It has nothing to do with advice with regard to how to be with each other physical. It's all the manifestations of a great sexual relationship that come out of a great relationship. And I think that this may not be the time that people want to, order a book, and who knows if Amazon's going to deliver anything over the next 6 months. But it is a book that should be taken seriously, because I think it does give people a very different perspective of what a really positive physical relationship is between two partners.
What's the name of the book, David? Some people are asking.
I will get it to you, Naomi, and you can get it to people. Okay, it's on. If you put in Peggy Kleinplatz in Amazon, it's her most recent book, and I think it's called The Secrets of Great Sex, but I'm not positive.
Great. Jody, did you have anything you wanted to add in terms of the relationship and the stress and any other physical manifestations of how we can partner well?
Well, one thing that I just wanted to add before that was related to what Judith was saying about staining is that sometimes irregular periods and staining can be a result of stress as well. And that's something that we encourage anyone who is experiencing that to consult with both their doctor and their Yoetzet Halacha or their Rav to find out what kind of staining it is, because so very often we put ourselves into nida when we do not have to. I think basically in terms of the, what we can do to help ourselves with this stress is first of all, the two words that come to mind are responsibility and intentionality. That we, even though this is in a book that I read, a great quote, it may not be your fault, but it's still your responsibility. So right now, it may not be our fault that we're being put into this very difficult situation, but it's still our responsibility to ourselves, to our spouses, and to our families, and to our country to do the best that we can to be the best people that we can be within our relationships. This is a time of social distancing, but it's not a time of social distancing. We really want to maintain the kind of relationships that are so important to us, and we have to be intentional about that. We have to really wake up in the morning intentionally, and I do this too, and it's not easy, is wake up and say, what can I do to be a better wife today? What can I do to be a better mother today? What can I play soccer with my son? He taught me how to run. That's not something I would love to do on a regular day, but I want to be intentional about my relationships. And the other thing is to recognize that right now we're going through, we're feeling grief. in addition to feeling stress and anxiety, we're grieving the things that we have lost or that we fear to lose or that we're losing. And we need to give ourselves a little bit of compassion. I love the word chemla in Hebrew because it just sounds pretty. But to give ourselves a little bit of compassion and chemla when we're going through all this, that we're doing the best that we can do, as long as we're taking responsibility and we're focusing on intentionality.
I think it's such a good message. The truth is, in general, to think about how we can wake up in the morning and say, how can I be the best and be intentional throughout life? And maybe this is something we can learn from this time. If we can just do a little bit every day and take that with us into our day, then it can really help us when we get past this to come out in a different way in terms of our relationships, in terms of our, our relationships with our spouses and our relationship with our children as well, for those of us who have children. But Lizzie, I want to ask you, because this is a specialty that you have, what do we do for couples who are not in a great relationship or even abusive? How do we deal with that?
I worry about that. I do. I think about, it's stressful enough being with your family all 24/7, literally 24/7. And if we have normal, healthy, happy relationships, it's great, but we sometimes have hard times with that too. But there are couples out there that live, with dysfunctional spouses. And these are very, very difficult times for them. For, let's say, women who live with a husband who is, God forbid, violent, emotionally or physically. These are really, really hard times. And I just want to reach out to those women, or everybody should reach out to those women. They should know that this is a time to, if you really feel like you're in danger, you should be in touch with your therapist. There are hotlines, crisis hotline is a good place to call. And the shelters are open also. We don't have there isn't a great solution for people who are stuck in the house all the time in a very dysfunctional situation. But if we try to, I don't know if the word is intentional, but try to keep things quiet. Sometimes it helps and sometimes it doesn't. If somebody's violent, that's not going to help. But we could try our best to
I think it's very important what you just said, that in every area there are crisis centers that are open and people can call, and if somebody needs help, they should reach out, and it doesn't have to be explosive, abusive in order for somebody to reach out. I think that's an important thing to be said. So thank you. Because we're getting short on time, I do want to turn to Judith for a second as a madrichat kalot, as a kala teacher who has so much experience, and just ask for some advice for newlyweds. We all have people we know who are getting married or supposed to get married, or what do newlyweds do in this situation? We can't hear you. Hold on. There we go.
Okay. I was also thinking about, in terms of newlyweds, this is young couples that are stuck together for 14 days alone. It could just be like a dream. Wow, amazing. This is wonderful. We have 14 days to, or not just be due, but like a whole month to be together. And then they start to realize that actually, what do they do with all their time together? And how do we deal with, like just being just the two of us day in and day out? And I think it's important, again, to realize that this is not normal life. That basically, also this will also come to an end. This is not normal life, but also to seize the opportunity, to make the best of the time, and to realize that there's going to be highlights and good moments, and there's going to be less good moments, and that's what life is all about. It's all about the ups and it's all about the downs, and all of that's going to happen in the weeks that they're together alone, just the two of them.
Great. That goes along with the question of, can you or can you not go to the mikvah? But this whole change time, this whole new time, this whole, for kalot, but for everybody, I think, is really something to understand the ebbs and the flows. Ruchama, I know that you have a question. Do you want to ask it out loud, or do you want to type it to us?
Yeah, I'll ask it here. I just wanted to ask about something that Lizzie mentioned way in the beginning. You just threw it out as a little thing about not having anal contact.
We can't hear you.
And I am there. If you could talk a little. Oh no.
Try again.
Can you hear me now?
Yeah.
Okay, wait, now I can't hear you. Okay, all right, now?
Yeah.
Is that good? Okay, sorry. Did you hear any of my questions?
Lizzie at the beginning addressed something.
Okay, addressed a little bit about anal touch. She said just something very small, that it's not safe right now because of coronavirus. I'm also a Kala teacher, and I'm wondering if that's something that I should be reaching out to the Kalas that I taught already and just tell them, hey, this is something you should know. And if there's anything else that people should be staying away from right now, or did I misunderstand that whole thing?
From what I understand is that the coronavirus lives in the gastrointestinal tract, starts from the mouth and ends in the anus. So what I understand is that any sort of anal sex is not a good thing, because if you get it on your hands and you get it or in your mouth or whatever, you can pass it, you can get the coronavirus back into your system. So
you were talking about people who are asymptomatic, not necessarily in bidud, just everybody. Is that?
There is no, even as somebody who's asymptomatic, we're all in danger, and there's no definite, there's no one says that we're not carriers, and nobody says that, the numbers are going up and the more people have it, even though they may be asymptomatic. So I was just saying, as a precaution, to stay away from that area, and to wash hands afterwards really, really well. It's a little difficult to make sure you don't touch anything, but to wash your hands well after sex. And I even think when, diapering babies, it's very important to wash your hands after. Well, we do anyhow, but to be more mindful of that area does, it could hold the coronavirus.
So I think a lot of people are asking as well, and David, I think you mentioned that you've seen some statistics. A lot of people are asking if that's the case. So how is kissing different?
There's nothing that I've seen anywhere that, as Lizzie describes, the couple who have been living together and sharing all kinds of physical experiences, that there's any risk for that couple with regard to kissing, as opposed to sharing any kind of other bodily fluids like through sexual intercourse. I've never seen anyone say that that's a problem. I've seen it as a problem where we're talking about non-permanent couples, non-consistent couples, dating couples who may have kissing as part of their experience. They should be cautioned, in fact, that they should not be kissing each other until all this is over, until they're both declared entirely free of any risk here. But again, I've not seen anything I've read about this that for married couples who have a normative physical relationship, that kissing is problematic.
Yeah, I'd like to add in terms of what Ruchama was saying about your kalot. One nice thing maybe, this is what I did recently with the kalot that I've taught, is I've just reached out to them and just said, if there's a lot of stuff going on, we have a lot of questions coming in about taharat hamishpacha and relationships and how to negotiate this, especially as a young married couple. And please, I encourage you to be in touch with me, to be in contact with me, because we know that there are so many questions coming up, and then that will open the door for them to bring up what's happening for them. And whether it's calling specifically to say anal sex is not recommended, maybe a little bit like mitzvah, maybe a little bit specific. But opening up the door for any of their questions is really such a nice thing for a kala to sort of know that you're there for them, and that they have an opportunity to speak to someone about these issues that they may have hesitancy in speaking to their doctor or their mother or their friends or their spouse. So as a kala teacher, I really would encourage you to reach out to your kalot.
Thank you. Thank you, everybody.
Great.
I just want to mention the reference I talked about before. The book is called Magnificent Sex, Lessons from Extraordinary Lovers. published by Routledge and written by Peggy Kleinplatz. Again, Amazon is not really operating too well at this point, but it's very valuable.
Jordana wrote in the chat that you can get it on Kindle.
You can get it on Kindle. Okay, that's news to me.
So everybody check it out if they want to. I want to thank you. I want to thank all of you for participating and sending your questions both before and during. We are more than happy to continue the conversation, and I really want to thank Dr. Ribner, Lizzie Rubin, Jody Waxpress, and Dr. Judith Fogel, and Dr. Amy Kesselman, who also took an active part in speaking. And if you have any other questions, they're happy to have an open chat about it and share the information with your friends. We'll be happy to send everybody a recording of this, since I did forget to put it on Facebook Live. But please feel free to share and send us your questions to info@theedencenter.com. You're more than welcome to continue the conversation with us, and we really appreciate everybody's participation and continued participation. So thank you for participating. Thank you for supporting, and we're more than happy for your feedback as well. Lila Tobin, thanks again.
Bye-bye, everybody.
Good night, all. Stay safe, stay healthy.
Thank you.
Oh, Naomi?
Yeah.
I think there was one question at the end that I wanted Dr. Kesselman to answer. Oh, did she just hang up? Oh, there was a question on the chat about kissing. Someone wanted to hear from a doctor.
So I think the most important thing really is to practice good hygiene. Couples that are living together 24/7 and they're not in bidud, they haven't had any reason to be careful from each other other than we're all sort of quarantined together in a house and not being able to go anywhere. Practicing the safest hygienic availability to you. Wash your hands multiple times, wash your hands with soap, be very careful even with touching. It does get transmitted from the nasopharynx, the oral route. So by the same way we would say to avoid any anal contact, we should be avoiding any oral sex as well, and kissing. But again, if two people that are feeling well, there's no reason, they haven't been exposed to anybody, they're together. So they're likely to transmit it in other ways, even touching the same utensils, touching the same thing. So I don't really want to restrict something that is not necessarily going to be transmitted by that particular way, because there's so many other ways that it's going to be transmitted. And really the safest thing to do is to practice good hygiene and wash your hands multiple times.
Oh, thanks. Great. Thank you so much.
You're welcome. Everybody stay safe. Thank you to the Asian Center for putting this together. It was great. Thank you for all the participants, and everybody should stay safe and healthy.
Amen.
Are we hanging up or are we staying on the line?